Have you ever felt a little surprised by the bill after a doctor's visit, wondering why the amount you pay out of pocket varies so much? Copays, which are fixed amounts you pay for a covered healthcare service after your deductible has been met, indeed differ significantly between Medicare and employer-sponsored health plans. These differences stem from their distinct structures, regulatory frameworks, and how they define covered services, networks, and out-of-pocket costs. The primary reason for these differences lies in how each system is structured. Employer plans are typically negotiated by companies with private insurance carriers, leading to a wide variety of copay structures that depend on the specific plan chosen by your employer. They often feature fixed dollar amounts for different services, such as $20 for a primary care visit or $50 for a specialist. On the other hand, Original Medicare, which includes Part A for hospital insurance and Part B for medical insurance, usually operates with a different cost-sharing model. For most services under Medicare Part B, after you meet an annual deductible, you are typically responsible for 20% of the Medicare-approved amount, which is known as coinsurance, not a fixed copay. However, Medicare Advantage plans, which are private health plans approved by Medicare, do commonly use fixed copays similar to employer plans, with amounts varying greatly depending on the specific plan you choose. To understand your specific copay situation, you will need to review your plan documents carefully. For an employer plan, your Human Resources Department can provide detailed summaries of benefits and coverage. If you are enrolled in Original Medicare, remember that most outpatient services will have a 20% coinsurance after your deductible, unless you have a supplemental Medigap plan that covers this portion. If you have a Medicare Advantage plan, you should consult your plan's evidence of coverage or summary of benefits for a comprehensive list of all applicable copays for various services, as these plans can have varied copay schedules. A crucial distinction often overlooked is the concept of coinsurance versus copay. While a copay is a fixed dollar amount, coinsurance is a percentage of the service cost. This means your out-of-pocket expense with coinsurance can fluctuate based on the actual cost of the service. Also, understanding the role of Medigap plans is key for Original Medicare beneficiaries, as these plans are designed specifically to help cover the gaps in Original Medicare, including that 20% coinsurance, which can turn a variable cost into something more predictable or even fully covered depending on the Medigap plan selected. Ultimately, managing your healthcare costs in retirement, whether through an employer plan or Medicare, requires careful attention to the details of your specific coverage. By understanding the fundamental differences in how copays and coinsurance are applied, and by proactively reviewing your plan documents, you can better anticipate your medical expenses and make more informed decisions about your healthcare budget.